Have you ever wished severe burns could be healed instantly, without surgery, without months of pain? In Japan, that future is already here. Bioengineers have created a portable skin bioprinter that can literally print new skin directly onto burn wounds, right at the accident scene. This device scans the wound, analyzes its depth, and then sprays living skin cells, layer by layer, rebuilding real human skin in just minutes. The process starts with a tiny skin sample taken from the patient. That sample is turned into a special cell solution and loaded into the bioprinter. Using multiple nozzles, the printer deposits keratinocytes, fibroblasts, collagen, and even hydrogel scaffolds, creating full-thickness skin that naturally integrates with the body. This isn't just basic tissue. The printed skin can include hair follicles, sweat glands, and pigment cells for realistic reconstruction. And the result? No painful graft surgeries, no long hospital stays, no months of recovery. Healing time drops from months to just weeks. Japan's emergency services already carry these bioprinters in ambulances, treating severe burns before patients even reach the hospital. But there's a darker side. Japan's self-defense forces have begun weaponizing this technology. On the battlefield, wounded soldiers can now receive instant skin repairs and return to combat, sometimes within hours. Injuries that once ended missions now become quickly repaired wounds. This raises serious ethical questions. Are we using medical innovation to save lives or to prolong war? Meanwhile, in the United States, burn victims still endure agonizing treatments and slow recovery. Portable bioprinting could change everything, yet development is focused mainly on military use, not civilian healthcare. So here's the question. Will this technology become a medical miracle for burn victims worldwide, or a tool to create combat-ready soldiers beyond natural human limits? The power to heal instantly is here, but how we choose to use it will define the future of medicine and war.